Today, we're going through 5 neurologic NCLEX questions. But I don't want you to just memorize the answers. For each question, I want you to identify the clue, decide what the question is actually testing, and then use that same strategy on another NCLEX question. So grab a piece of paper, keep track of your score, and let's see how many you get right. Here is question number 1. A patient with a traumatic brain injury is being monitored for increased intracranial pressure. During reassessment, the nurse notes several changes from the previous neurologic examination. Which findings indicate late neurologic deterioration? Select all that apply. A. Increasing restlessness and confusion. B. Headache with vomiting. C. Widening pulse pressure. D. Unilateral extremity weakness. E. Dilated unequal pupils. F. Decorticate posturing. Pause the video and choose your answers. The correct answers are C, E, and F. The most important word in this question is late. NCLEX loves to test the difference between early and late signs of increased intracranial pressure. Let's go through the choices. A. Increasing restlessness and confusion. Incorrect. This is concerning, but changes in level of consciousness, including restlessness, agitation, and confusion, tend to occur early as intracranial pressure begins to increase. B. Headache with vomiting. Headache and vomiting are also common findings with increasing ICP, but they can occur earlier in the progression. C. Widening pulse pressure. Correct. This is part of Cushing's triad. Cushing's triad includes widening pulse pressure, bradycardia, and irregular respirations. When you see this pattern, think significant intracranial pressure and possible brainstem compression. D. Unilateral extremity weakness. Incorrect. Motor changes are concerning, but weakness can appear before the classic late findings. E. Dilated, unequal pupils. Correct. Unequal or dilated pupils suggest worsening neurologic compression. This is not a finding you watch casually. This patient is deteriorating. F. Decorticate posturing. Correct. Abnormal posturing indicates severe neurologic dysfunction. Decorticate or decerebrate posturing should make you think advanced neurologic deterioration. So here is your NCLEX takeaway. Early increased ICP. Changes in level of consciousness, restlessness, headache, vomiting, and motor changes. Late increased ICP. Abnormal pupils, abnormal posturing, irregular respirations, and Cushing's triad. If the question says late, do not automatically choose confusion just because it sounds serious. Look for evidence of severe neurologic deterioration. This is question 2. Now let's move from the brain to the spinal cord. A patient was admitted following a motor vehicle crash and has a confirmed spinal cord injury at the C5 level. The nurse is completing the initial assessment during the acute phase of care. Which 3 nursing actions should receive priority? A. Assess respiratory rate, depth, and pattern. B. Evaluate bowel sounds and abdominal distension. C. Maintain a patent airway. D. Perform passive range of motion exercises. E. Maintain cervical spine immobilization. F. Establish a bowel training schedule. Select 3. The correct answers are A, C, and E. Before you even look at the options, think airway, breathing, prevent further spinal cord injury. A spinal cord injury around C3 through C5 can affect respiratory function because this region is associated with the diaphragm. Remember, C3, C4, C5, keep the diaphragm alive. Now let's break down the choices. A. Assess respiratory rate, depth, and pattern correct. With a high cervical spinal cord injury, respiratory status can deteriorate. The nurse needs to watch the patient's respiratory rate, depth, pattern, oxygenation, and ability to ventilate. B. Evaluate bowel sounds and abdominal distension. Incorrect as a priority. Bowel function matters. Spinal cord injury can affect gastrointestinal function. But this is an acute situation. Bowel assessment does not take priority over airway and breathing. C. Maintain a patent airway correct. This is one of your highest priorities. If respiratory muscles are compromised, the patient may not ventilate adequately. D. Perform passive range of motion exercises incorrect. Range of motion exercises will become part of the patient's care, but they are not the immediate priority following an acute cervical spinal cord injury. E. Maintain cervical spine immobilization, correct. You want to prevent additional movement that could worsen the spinal cord injury. Until spinal stability has been established, maintain proper immobilization. F. Establish a bowel training schedule incorrect. That belongs to longer-term management and rehabilitation. So remember this. When NCLEX gives you an acute cervical spinal cord injury, especially a high cervical injury, think airway, breathing, immobilization. Do not get distracted by interventions that are appropriate later. Question 3. Now let's stay with spinal cord injuries but change the situation. A patient with a spinal cord injury above T6 suddenly develops a severe headache, facial flushing, diaphoresis, a blood pressure of 204/108, and a heart rate of 48 beats per minute. Which actions should the nurse take immediately? Select all that apply. A. Sit the patient upright with the legs dependent. B. Assess for bladder distension or an obstructed urinary catheter. C. Place the patient flat in bed. D. Remove restrictive clothing or blankets. E. Administer a rapid intravenous fluid bolus. F. Monitor the blood pressure frequently. Pause and choose your answers. The correct answers are A, B, D, and F. This patient has classic autonomic dysreflexia, severe hypertension, bradycardia, severe headache, flushing, and sweating, and a spinal cord injury above T6. This is an emergency. Now let's go through the actions. A. Sit the patient upright with the legs dependent correct. This is one of the first things you do. Sitting the patient upright helps lower blood pressure through gravity. Do not leave this severely hypertensive patient lying flat. B. Assess for bladder distension or an obstructed urinary catheter, correct? After positioning the patient, you need to find the trigger. And one of the most common triggers is Times bladder distension. Check the urinary catheter. Is the tubing kinked? Is the drainage bag full? Is the catheter blocked? Is the bladder distended? C. Place the patient flat in bed incorrect. This can worsen the hypertension. The patient should be upright. D. Remove restrictive clothing or blankets correct. Anything causing irritating stimulation below the level of the spinal cord injury can trigger autonomic dysreflexia. Loosen clothing. Remove restrictive devices or blankets. Check for anything that could be causing pressure or discomfort. E. Administer a rapid intravenous fluid bolus incorrect. Look at the blood pressure. This patient is already severely hypertensive. A rapid fluid bolus does not address the underlying problem and may worsen the hypertension. F. Monitor the blood pressure frequently correct. This blood pressure is dangerously high. Continue reassessing while you search for and remove the trigger. For NCLEX, I want you to remember this sequence. Sit them up. Find the trigger. Remove the trigger. Monitor the blood pressure. And when you search for the cause, think bladder first, bowel second. Then other irritating stimuli. A full bladder, fecal impaction, restrictive clothing, pressure injuries, or other painful stimulation below the injury can trigger the response. If you remember that sequence, autonomic dysreflexia questions become much easier. Question 4 is a different type of neurologic disorder. A patient is being evaluated after reporting increasing fatigue and difficulty completing usual activities. The nurse suspects myasthenia gravis based on the pattern of the patient's symptoms. Which findings support this suspicion? Select all that apply. A. Muscle weakness that worsens with activity. B. Ptosis and diplopia. C. Numbness and tingling of the extremities. D. Difficulty swallowing and choking. E. Muscle strength that improves after rest. F. Positive Romberg sign. Pause the video. The correct answers are A, B, D, and E. The hallmark of myasthenia gravis is fatigable skeletal muscle weakness. The more the patient uses the muscles, the weaker they become. Rest allows the muscle strength to improve. That one concept can help you answer several questions. Let's go through the options. A. Muscle weakness that worsens with activity. Correct. That is one of the defining patterns of myasthenia gravis. Activity makes weakness worse. B. Ptosis and diplopia. Correct. The muscles controlling the eyelids and eye movements are commonly affected, so you may see drooping eyelids or ptosis and double vision or diplopia. C. Numbness and tingling of the extremities. Incorrect. This is a sensory finding. Myasthenia gravis primarily affects skeletal muscle strength. Sensation is generally preserved. If the question is emphasizing numbness, tingling, or sensory loss, think beyond myasthenia gravis. D. Difficulty swallowing and choking. Correct. Bulbar muscle weakness can affect swallowing. This matters because dysphagia increases the risk for aspiration. Patients may also have difficulty chewing, speaking, or managing secretions. E. Muscle strength that improves after rest. Correct. This is another classic feature. Weakness worsens with repeated activity and improves after rest. F. Positive Romberg sign. Incorrect. A positive Romberg sign suggests problems with balance, proprioception, or sensory pathways. That is not the characteristic pattern of myasthenia gravis. Here is the NCLEX pattern. Myasthenia gravis equals muscles get weaker with use and stronger with rest. Think eyes, swallowing, speech, respiratory muscles. And remember that the patient generally does not lose sensation. One more priority point. If a patient with myasthenia gravis suddenly develops worsening respiratory weakness or difficulty handling secretions, that becomes an airway and breathing problem. Last question. A patient with a history of seizures is admitted to the neurologic unit after several recent episodes. The nurse reviews the events to determine whether the patient experienced status epilepticus. Which two situations meet the criteria for status epilepticus? A. A generalized seizure continues for more than 5 minutes. B. The patient remains confused for 20 minutes after a seizure. C. Two seizures occur without the patient regaining consciousness between them. D. The patient sleeps for 30 minutes after seizure activity. E. The patient reports an unusual smell immediately before the seizure. Select 2. The correct answers are A and C. There are two patterns you need to recognize. The first is a seizure lasting 5 minutes or longer. The second is repeated seizures without recovery of consciousness between episodes. Let's go through the choices. A. A generalized seizure continues for more than 5 minutes. Correct. This meets the definition of status epilepticus. Do not wait for a seizure to continue for 20 or 30 minutes before recognizing the emergency. 5 minutes matters. B. The patient remains confused for 20 minutes after a seizure. Incorrect. Confusion can occur during the postictal period. That alone does not mean the patient is in status epilepticus. C. Two seizures occur without the patient regaining consciousness between them. Correct. Even if each seizure is relatively short, repeated seizures without neurologic recovery between episodes meet the criteria. D. The patient sleeps for 30 minutes after seizure activity. Incorrect. Sleepiness and fatigue commonly occur during the postictal period. E. The patient reports an unusual smell immediately before the seizure. Incorrect. An unusual smell may represent an aura or focal seizure manifestation. It can help identify seizure activity, but it does not define status epilepticus. So remember, 5 minutes or more, or repeated seizures without recovery in between. That is status epilepticus. And once you recognize it, think emergency priorities, protect the airway, support oxygenation, prevent injury, establish floor access when possible, prepare for rapid seizure treatment. Final review. Let's see how you did. Question 1. Late signs of increased ICP. The answers were C, E, and F, widening pulse pressure, unequal pupils, and decorticate posturing. Question 2. Priorities after a C5 spinal cord injury. The answers were A, C, and E, respiratory assessment, airway maintenance, and cervical immobilization. Question 3. Autonomic dysreflexia. The answers were A, B, D, and F. Sit the patient upright, check the bladder, remove restrictive stimuli, and monitor blood pressure. Question 4. Myasthenia gravis. The answers were A, B, D, and E. Fatigable weakness, ptosis and diplopia, swallowing difficulty, and improvement after rest. And question 5, status epilepticus. The answers were A and C. A seizure lasting 5 minutes or longer, or repeated seizures without recovery of consciousness between them. How many did you get right? More importantly, could you explain why the other choices were wrong? That is where NCLEX questions become easier. Don't memorize individual questions. Learn the pattern behind the question. If you want more NCLEX practice, where we break down the clues, eliminate the distractors, and explain why the answer is correct, subscribe and come back for the next set. You can pass this NCLEX. I got you.